So good morning. Welcome to SCARP, Somerset County Association of Resource Providers. This is our October meeting. I'm jumping ahead a little bit, so I apologize. I'm just so excited for the in-person. So I guess that's where that eagerness comes from. I'm Lisa Meacham. I'm the Director of Social Services at Woodlawn. I am the elected president for SCARP, and I also co-chair the Somerset County Domestic Violence Task Force. So I'm just going to call folks. I think that goes smoother for introductions, and then we're not guessing who went. So I'm going to go to my right on the screen, and that's Deb. Good morning, Deb.
Good morning. I'm Deb Newcomb from Maine Parent Federation, the statewide parent training and information center for parents and caregivers of children with disabilities or special health care needs. And our services are statewide, but I do work in our central office in Farmingdale. And I'm the regional family support coordinator for the Family Support Navigator program, which is our peer-to-peer support program, where we're matching a parent with another parent for some support all around different topics. The big ones are special ed or transition to adulthood, voc rehab, main care, Katie Beckett applications, that type of thing. But we do all kinds of services. We have parent information specialists in our office that talk to parents daily. We have trainers that have a lot of different trainings. They're all listed on our website, and some of them are pre-recorded, so you can go in and watch those at any time, or refer parents to the website to watch those or to contact us if you're talking to parents who fit in our category of services. And our website is MPF, the initials for Maine Parent Federation.org. And thank you.
Thank you so much, Deb. Nicole, good morning.
Good morning. I'm Nicole Marchese from the Maine Long-Term Care Ombudsman Program. I oversee the volunteer program statewide, but I also cover Knox, Piscataquis, and Somerset County as a regional ombudsman. Just a little recap of what we do. We are advocates for individuals residing in long-term care across the state. So we provide advocacy around quality of care, quality of life issues in nursing homes, residential care, and assisted living. But we also help with any complexities, navigating complexities of long-term care. So those are individuals receiving home care or maybe making that transition. We provide advocacy on walking individuals through that complexity. We do a lot of other things, but that's our main philosophy of our program of what we do.
Thank you. Jody, good morning.
Good morning. I'm Jody Waterhouse from Catholic Charities of Maine. I am a program coordinator here for the RSVP program. We focus on connecting volunteers to homebound seniors to fight isolation and help with transportation. And most recently, we're going to start working on food insecurities.
Thank you. Good morning. Hi, Dana.
Good morning. I'm Dana Hamilton with KB CAP. I'm a resource navigator, and I'm here in Skowhegan.
Good morning. Hi, Rob.
Hey there, Rob Rogers, Kennebec Behavioral Health, Director of Substance Use Prevention and Grant Services, and the Respect Me program, which is a certified domestic violence intervention program working with females.
Good morning, Linda.
Good morning, everyone. My name is Linda McKenzie. I work at Somerset Public Health, and I'm the project manager for the Pathways to Recovery project grant. The project looks to help connect people looking for treatment for substance use disorder, opioid use disorder, helping them find resources if they're in treatment for recovery, and all things related to addiction treatment, prevention, treatment, and recovery in Somerset County.
Good morning, Michelle.
Good morning. I'm Michelle with Family Violence Project. We're the Domestic Violence Resource Center serving Kennebec and Somerset counties. I think that's all you need from me. Thank you.
Good morning, Sonia. It's good to see you.
Good morning, Sonia Campbell. I am representing Maine Families with KB CAP. We serve prenatal. We can enroll up to the 3 months for the child, but then we can stay for 3 years, and we do in-home visits. I'm also the treasurer of SCARP, and we have 1,700 in our account. We're doing well, and we'll be hopefully using some of that this year for some projects.
Good morning, Pastor Jen. It's good to see you.
Yes, sorry, I was a little late. I had to take a last minute call. I am Pastor Jen from Centenary United Methodist Church on Dr. Mann Road, and also the project manager of Common Unity Place. We have the free clothes closet, the Cup Cafe that offers free lunches on Wednesdays, and also our Tuesday evening meal program with community partners. It offers a free meal on the second and fourth Tuesday of each month. I have a poster, which I will post in the chat for our upcoming meal on Tuesday, if you might know people that would benefit. Thank you.
Thank you. Tara.
Good morning, Tara Harvey from KB Cap, Resource Navigator alongside Dana.
Thank you, Tara. Brittany.
Good morning, everyone. Brittany Dunphy. I work over at Reddington Fairview General Hospital, and I am also the secretary for SCARP.
So we're going to move right into our agenda. We're going to talk about our quarterly in-person meetings. And I did meet with Pastor Jen to complete the facility agreement in the safe sanctuary policy. She's been gracious enough to donate the space to us for our quarterlies. Brittany did send out a list of meetings as well that also list when those quarterlies are and the location for those. Our first quarterly or in-person meeting is going to be held on November 17th from 9 to 11. We'll send the agenda out. We're going to do the same as we do in person. And then we're looking for some feedback from all of you as to any presentation or specific information that you're looking for that we can start working on for that November in-person meeting that is scheduled as well. I know that there is a lot of awareness for the month of November. And so, you know, if that's part of that, I know we have Veterans Awareness Week, which is actually starts and is part of and is going on during the week of our in-person. But you've got pancreatic cancer awareness, diabetes awareness, epilepsy awareness, prematurity awareness, things along those lines. And so really looking at what are your needs? What would you like to see for our first in-person meeting? I know we can't have them all, and I send out the list and that's a lot of stuff, Lisa. And it really is. And then I thought, well, we're resource providers. So there is definitely folks within this group and in our community that provide, you know, education and resources around all of those topics, you know. So we have a lot of folks here that are representing a wide range from, you know, gestation or neonatal care all the way through to long-term care. You know, narrowing that down is going to be probably be a little bit more challenging.
Lisa, I may have missed it. I was sending a private message to somebody else. How much time are you looking at for the presentations?
Well, we wanted to really stick true to what we had, but and we wanted to do the resourcing. And so we talked that would be the first hour, like our Zoom. And then we're looking for that hour piece of following that. I know at times there are some we talked with, like when Kristen was here, and some of her trainings are much longer than that hour time. So that might also be a challenge that we're looking at too, if we're doing some type of training that's going to require more than that hour slot and making some adjustments. I know we tried to stay as true to what we were doing previously when SCARP was able to meet in person, and really having that networking, which is why we're here, but also, you know, highlighting, you know, a particular agency and what they're doing in the community, you know, for citizens in Somerset County. You know, doesn't necessarily need to be the full hour, but just, you know, helping us all know what you're doing and what that really looks like. You know, you know, Nicole, when she introduced herself and said ombudsman, that's just a tip of what they do. And she's right. I mean, they advocate for a lot of folks within, you know, so that would be, you know, opening that up so that we all know. Maine Families and KVCAP do a lot of different resources and services for citizens in Somerset County. So, you know, what does KVCAP offer? You know, Catholic Charities, you have a home-based program, you know, where you used to go in per homemaker services and things like that. A lot of people have lost sight of that and don't really realize that that program is still available. So it's, you know, introducing us to that and what that is for folks too. You know. Hi, Brittany.
Hi, I just wanted to jump in, just in case folks want to think about it, because there might be, might not be sure what you want to present on. I am going to put a link in the chat of the spreadsheet. It's just on view mode, but that's how we're going to keep track of who's presenting on what in-person meeting. So you can look at the date and the times. The presentation time on the spreadsheet says 10 to 10:45, just to leave like that last 15 minutes for question and answer if someone wants to talk, you know, with someone about that. So I figured instead of having people just enter on a date that they want to, if they could just email the SCARP email address, and then I can plug them in wherever. So if you just want to, if someone wants to take time to think about it, they can also cross-reference the spreadsheet to see what day and time might work.
I'm happy to do a presentation on the Pathways project. Betsy can do a Narcan training if people are interested. We also have a person that her title is called Patient Navigator. She also works at Somerset Public Health, and she could join us as well and talk to you about some of the work she does. Some of you may run into folks that need help with anything from filling out applications to main care, knowing how to navigate certain situations. And she's a great person that does like a ton of stuff. Last night, Betsy and Cynthia and I went to El Rancho de la Vida, which is a recovery residence at Hinckley campus. And we talked to the residents about what do they, if they could talk to people in the community, what would they tell them to make that better from that moment that they thought about seeking treatment, when they're in active addiction, from the moment they thought about seeking treatment to actually doing it, right? Do they need help with what? And they said, you know what we need? We need to know where to go. And they all said the same thing, like, we thought about it, but we just didn't know who to reach out to or how to get help or services. One person said, well, I had a police officer arrest me, and he said, you're either going to go to the hospital for treatment or you're going to go to jail. And he says, I'll take the hospital. But he says, before that, he says, I didn't know where to go for help. So I think that's for us a big part of our messaging is like just information campaign and getting information out to folks. So we'd like to share that with this group so that at least you know what's available.
Wonderful. Thank you.
November wouldn't work well for me, but the next time you have the in-person meeting, what's the next date?
February 16th.
Yeah, if you, Linda, want to just open up that spreadsheet and just save it and, you know, talk to Betsy and Cynthia. And if anyone that's interested in presenting, if you could just, with your topic, send all of the dates that work for you. Like if you're interested in presenting in November, but we already have someone, but also February works for you, that would be good for us to know too. And I can put the email address in the chat as well. Piece of information that we want them to know.
Any other thoughts before we move on to our next? Actually, we were talking about that presentations trainings as well.
Lisa, did you say you sent, we've got construction going on here, so I'm getting about half of what's happening. Did you say you sent out a list of possible trainings or whatever? And also, I don't think I got an agenda. I didn't get anything this week from SCARP.
When I sent out the list of ideas, that was to the SCARP board and
Oh, okay.
creating a list of topics and what might
Okay.
be, available for the month of November for prevention or just awareness
Okay.
as well.
Well, and it could be that the other thing got buried somewhere in the bajillion emails and I just missed it, but yeah, okay. Just asking. Thank
Oh,
you.
perfect. You're welcome. Thank you. Hi, Jen.
Hi, I just say that I don't know if I need time for a presentation, but certainly I would be happy to give a tour for anyone that has not been to our facility so that they can see what the clothes closet is all about. And we have been blessed with a grant from the CDS RFP, and there's going to be some significant changes towards food insecurity and trying to help overcome that and through our programs in the coming months. So maybe later, maybe in the spring, after we've been able to utilize some of those funds, just to kind of show folks what's going on. It's pretty exciting. Thank you.
Yeah, you guys have some great things happening at the church for sure. I don't see that Karen was able to make it this morning regarding an update on the community fridge, so I apologize for that. But I do want to chat with Dana for a minute. We had talked at our last meeting regarding a resource fair of some sort, and you had some connections. I just wanted to touch base and see where we were at with that. If
I did talk to the Career Center and they said, well, we just did the one at Head of Falls and Waterville. So it'd probably be a while before we do one again. KVCC said they had just done a little fair for the students. And so, but that they may well be looking at doing something in the spring. And if so, that Elizabeth would be in touch with us and we could talk about possibly piggybacking with them.
perfect. Thank you so much.
Sure.
I know at the previous meeting, we talked about work groups. We had some ideas and thoughts that we wanted to do and where we wanted SCARP to go. The community fridge being one of those. I just drew a blank on the word. One of the needs that we've been able to identify in the community that we want to take part in. And so we were looking at, work groups set on, exploring what other options, what are some other needs in the community, and then how we can, represent it and take part in some of those. Michelle said she's always happy to do some training. We love your trainings, Michelle, regarding domestic violence. Thank you. Quiet group of folks today. You're gonna put me on the spot.
We all need that second cup of coffee before the brain kicks in.
Hi, Pastor Jen.
Yeah, so my apologies, but are we going to talk about the community fridge today, or did you talk about that in the last? Because I couldn't make the last meeting because of. Yeah,
we did talk a little bit in the last meeting on the community fridge and where they were in that Karen had been able to submit the paperwork, and please somebody step in if I don't have all the information regarding the grant. Was informed that she had a good possibility, or they had a good possibility of receiving the grant, but they were still in the process of reviewing all of the applications. Is that correct? Did I get everything?
I believe so.
Okay.
From what I understand, they had asked her to do a second round of not necessarily an application, but she had to explain in person the purpose behind the application. And she was hoping that at this meeting, she would have a definite update. And we have not received one, so I can reach out to her and send that by email.
that's because I would be very interested in supporting that. if they did get something started, because we did support that almost on a weekly basis when they had the one downtown. So I just wanted to stay on top of that so that I could support that initiative.
No,
Thank
thank you for bringing that up. Is there, and I'm putting you all on the spot as well. So when it comes to SCARP and raising awareness and the things that we do here, is there a particular topic outside of the community fridge that has been an interest for folks and that we really need to look deeper at and see how we can, support that work within the community?
I can't believe I'm saying this, being from KV Cap, and I don't know that there's anything we can do about it, but certainly transportation continues. I mean, we have our Explorer going, but if you can't get to where the route, to the route even, and if you're an older person, you may not be able to, just to do your grocery shopping or whatever. And certainly if you have insurance, the medical appointments will come to you, but it's Aurora County, so folks have sometimes can't even get to where the bus stops are. And I have no idea. I mean, that's been an ongoing thing, the whole time I've lived here. So I don't know if there's anything that we can tackle on that, but it's out there.
And I don't know what this group could do about this, but just in this last week, I probably received 6 calls from people who are either going to be out of a place to stay, like they've been staying at a hotel, for instance, and they're going to be on the street soon. And it's been so disturbing to me. I've stayed awake nights. I mean, we're such a small little church. I say, come to us for food and clothing. We will help you. But I mean, there's so much need and there's so much fear. I don't even know. It's just a little bit, I guess I feel hope because we're all here today, right? It's not just Jen sitting there on the end of the phone saying, I'm sorry, have you called this organization? And most of the time they've said yes. They've called the different organizations, and there's just, so I'm just wondering what this winter is going to bring.
And unfortunately for those individuals that were using the rent relief through COVID, that is ending. And so all of those, I believe it's ending in November, which is a tough time of year for it to end. No, it's not as extended more. Someone's shaking their heads.
So rent relief officially ended September 29th at 5 p.m. Any applications received after that are not eligible for services. Those received before that time will be worked by the current staff. And what money is left will be allocated. Pastor Jen, I hear you 100%. We've sent people your way. We've sent people in 100 different directions because rent relief has been encouraged to send clients that need further assistance to the 3 of us, myself, Dana, and Michael, who's in the Waterville office, to try and connect them. And we just don't, we have no options. We try the best, whatever, the GA system, the church system, the Salvation Army system, whatever we can think of. But we're running into a brick wall, and we don't have any rapid solutions either.
And I've had several of them say, interestingly, that they're FEMA. So so you're wondering, FEMA, you're wondering, I just wonder about if they've come here from another location, that they found housing in this location from somewhere else. I don't know, but anyway,
I believe, don't quote me on this 100%. I believe if it was a FEMA hotel, that was through the homeless shelter.
Thank you for that clarification.
And they don't attend this meeting at this point, but And they're so busy is the issue, but we do have a program at KVH serving both youth and adult, but there's different criteria with the PATH grant. If that is something people wanted more information on, I could speak to Tracy, who oversees that, and see what they're providing for services. I'm not well enough adept in that to actually speak for that program. So. Yeah,
Well, the
Tara,
fact-
it is still around. I know that they were down a case manager at one point. They work very weird hours. They go out, they literally will go out to tent encampments in the middle of the woods. They go under bridges. They literally seek the people out. And they cover it's bigger than even Kennebec and Somerset. They cover Androscoggin and I think the coast. They contract with some other agencies as well, but they have expanded. But I do know for adults, the definition, like they can't be couch hopping. They literally have to be homeless in order to qualify for their services.
But part of the problem is, where do you put them? I mean, there's not even, I've
Right.
just started seeing a few rentals show up in the paper, but for the most part, there isn't anything. And if there is, it's not affordable. It's not
Right.
sustainable for the folks that we serve.
Yeah, I have people with 2 incomes that can't find affordable housing,
Right.
let alone someone who's homeless.
Yeah.
Yeah,
Exactly. Well, and the other thing is, even in good times, most of the even Section 8 required, the security deposit and this, and it's like, where do you think this money's coming from? They wouldn't need Section 8 if they had that money. So it's not a system that's working very well, in my opinion. But there really isn't any, there just aren't any rentals or available spaces out there.
And it's also landlords accepting that type of payment. When I was at Preble Street 7 years ago, it was a nightmare because they've been burned in the past so many times. And so it was like bridging that gap. So if you had landlords that used it and something bad happened, it was really trying to like advocate for them to reuse that funding. And that was a struggle within its own. So I think there's so many different variables.
Well, it has been known in Somerset County, and I'm sure in other counties, that during those eviction processes through the court system, landlords at that point too, that are there for their own reasons, are also writing names down for those that are also there. So that's eliminating your housing as well for folks, if you're already blacklisted before you even get started. Now, I could say I did see an apartment that was available for rent. Whether it still is or not, I don't know. Whether anybody wants to live in the building, I'm not sure. It is the green building right after Al's Pizza on Waterville Road. So there is an apartment there for rent. I did see that. So I know that's not always a ideal location with the street right there, but it is an apartment for rent. So
I was just thinking, when I'm dreaming dreams is that if we had a generous landowner that would be willing to put in one of those small house communities, those small home communities. I've been researching some of that online and the way that, they set up the homes and the spaces. And I was thinking, boy, wouldn't that,
do you know if they're even permitted? Because I've heard some communities where they don't even allow them. What constitutes a home doesn't fit the criteria for those tiny homes in some communities.
I would love to, if I had the, that's just a whole thing. If I was, had another gen, then I would research that to really take that on, because it seems in some areas it's working.
well, I do know the Veterans Administration has actually donated some of those tiny homes and other counties within Maine to help with the veteran homeless population. So that has been, at least through the VA, that's been done. I know at least in Washington County.
I do see a question Michelle asked, is there a warming center in Skowhegan? We consider ourselves a warming center, at least on Wednesdays. And like in the summer, we were doing that for cooling. And then we did open up on other days when it was extremely hot. we did open up for a cooling center. So I would imagine, again, if I have the volunteers that are willing to be on site, that if there's some extremely cold weather, that we will do that again. You know, we will do that this winter to the best of our ability.
Jen, isn't there a consortium of churches that, so that some of that burden can be shared and you could rotate the warming centers, or excuse me for the noise, but yeah.
You know, I have reached out to some other, sometimes I don't get a lot of response when I try that, and maybe I just need to knock on the door a little louder.
Jen, when you talk about having enough volunteers, if they're not affiliated with your church, are you talking about members from the community? And what does it entail being like to have the warming center? What are you looking for assistance in those situations?
Well, I mean, we have people right now who once came and received our services that are now there volunteering. So, I mean, they do not need to be a member of our church. We've really developed like a family out of people that live right across the street from us that walk over and take part and help out every week. And I have an older congregation, very small, but passionate about being in community and building community and being a good neighbor. And that's really what it's about, just being a good neighbor. And so if there was other organizations that might want to, you know, help out in some way, just give me a call and we will work something out with that. Certainly. Thank you for asking, Ron. Thank you.
I mean, I can't speak for the group, but what I can say I'm willing to do is bring it to ROAR, which is a lot of the recovery coaches. And I'm wondering if that's a place where they could potentially go, if needed, be offering their services, but it's a place for them to just sit, have coffee, be a place, but yet they're also volunteering at that time. Maybe, you know, kill two birds with one stone.
Well, that's as we are trying to develop CUP, Common Unity Place. I mean, it's right there in the name of us, a Common Unity Place, right? And so if there are organizations that want to use our space, it would be like a third party coming in and using our building. You fill out a little you know, or if it was on a warming day, you know, or warming center or cooling center day, we could certainly work that out. Because we're hoping that other organizations will want to come on Wednesday and table, because just in the last few weeks, we've had almost 100 people a week coming through our doors on a Wednesday from 9 to noon. I mean, so, and 5 to 7. Last week, we served almost 45 lunches in 3 hours. So, with very little advertising, because we're still trying to get around that. So, but everyone knows that we have clothes. That's what we're known for. So. Yes, Jody. Yes, very good, Jody. Yeah, absolutely.
Do you guys, I know I'm seeing a lot of individuals like needing home care and maybe nursing home placement from the community. A lot of, you know, they're on fixed incomes, aging. I'm seeing a lot of individuals entering the homeless population or have been. So I'd be curious about doing some outreach, but also like lending a helping hand as a volunteer, like during those meal times, because I think that there's such people don't know about our free services as an advocate to be able to walk through those complexities. And I'm just seeing like an avenue of potential outreach, but also giving back to the community at the same time. So I'd be happy to talk to my city ombudsman to see if that's, if she feels that would benefit my time doing outreach in that capacity, but also benefiting you and the community at the same time.
Because we do have a lot of seniors. We are actually now beginning to get a lot of young mothers who are coming in with their children. And I've got diapers there, thanks to Kristen and KV Cap. And when I hand them a sleeve of diapers for I mean, I had one mother that literally cried. She was so thankful. And we've had toothbrushes and I mean, it's been great to be able to share this with other people. And for us, it's now working on a website just to get people just to know we're there. And they're just finding out about us and they're like, how long have you been here? You know, so it's just us getting the word out, but willing to partner with anyone that's interested, willing to do that. And
The
so.
church also is one thing that Pastor Jen didn't mention is the medical equipment that they're able to help folks with as well.
Yes, we do have a lot of walkers. We have some wheelchairs, commode, shower, the small items, not beds or things like that. But if you know someone that is in need, we've done a lot with KBH lately that has called with folks needing that, and we've been able to help them out. It's free. People take it, bring it back.
And I think hospice still has some beds, maybe they're storing too.
Yes,
Yeah.
and I work, Amy and I kind of refer people back and forth.
Yeah,
Yes.
good.
Yeah.
It's an ongoing project. I'd like to see this group spend some time thinking about how we can get information out to the community and the public. I think that's just going to be an ongoing thing. You know, how do we let people know we're here, that there are people to help? We may not have all the answers, but we certainly can give them information and resources. Here's an example. We had talked, we had asked the folks at the recovery residence, where can we put information up around treatment, that treatment's available? And one young woman put her hand up and she said, you know what? She said, put them at the ATM machines. When I was using drugs, that's where I'd go. Who would have thought, right? I would have never thought to do that, but just to think differently about how we can get information out to the people that need this information and services that we have to offer.
I think one of the challenges is because we do have an older population, they're not going to go on Facebook and look for information or whatever. It's all by word of mouth, or still in the newspaper, they're still getting the hard copy of the Sentinel or of the, what is it, the Mainline or whatever that little weekly newspaper is that is in my mailbox every week. So maybe utilizing and was it Coffee News or whatever it is, the things that are in the little restaurants. So we need to think more for them. Two things, one about more print stuff around available, but the other thing is making sure that we keep it on a reading level, because our average reading level in our county is only 4th grade. So we want to make sure that our message is clear to folks on a readable basis.
I wouldn't have thought, Linda, either about the ATM machine, but it does make perfect sense. But when was the last time you saw anything advertised outside of the ATM? But you're right, it's meeting people where they're at. And if that's where they're at, it'd be ideal to put some info there as well.
According to the Community Needs Assessment survey, the China report, 1/3 of our seniors 65 and over live alone. Right, so that's the other part, is that how do we get information to them, whether it's the Somerset Express, those coffee news things, putting flyers into bags at the food pantry. Food pantry folks typically will, if you have information, they'll stuff that when they put their bags of food, they'll put those flyers in there.
Well, also finding out who those basic leaders are that are at the little gatherings that happen in all the communities of seniors, like in Fairfield, they have a huge senior group there that meets, but finding out, you know, the feedback I had when all those groups started was that they didn't necessarily want to be educated about anything. So they didn't want speakers coming in, but you know, if there was something printed that we could leave with one of those people to share, that might be helpful. And I'm also wondering, and this may be way out of our realm, but I notice a lot of times the Irving stations, and I always go to Irving, so maybe the other ones do too, have started having like little vignettes and advertisements while you're filling up gas. I wonder what it takes to get something on those little screens. I don't know, it's a thought. I'm thinking way outside the box. I'm on my 2nd cup of coffee.
Money. That's what it takes.
Money, yeah, probably. Yeah, well, you know, Irving's supposed to be, you know, doing things, giving back to the community, as they say, blah, blah, blah. So who knows?
Well, Rob, I don't know if you saw the news this morning when it came to the Circle K's in Florida that are now
I
opening up medical.
did.
Okay, I am like, are you kidding me? It's an all-stop shop at that point, but
What
Yeah.
are they doing, Lisa?
they are in Florida. They are opening up medical marijuana shops in the same building as their gas stations for Circle K. So that you can utilize both while you're there, get your grass and your gas, apparently. There's a slogan.
I think that was already taken. There was a place in Augusta doing
Did it?
that. Right across
Oh.
from the old Sears. Yep.
You know, and Linda made a good point. We all are. How do we get information out? You know, you can find information on the web, and I'm going to go back to the marijuana piece because you've got your weed maps and you can Google just about anything. Why is it so difficult to find that same information at your fingertips when it's important issues like recovery or substance use, you know? I was reading, I'm sorry, in the comments about there are several next to a Dunkin' Donuts in Maine
Yeah.
as well.
That's a whole
On-
other training topic, you know.
Yeah, I know, I'm
knowing,
speechless.
is it-
I'm looking
is
at
it
this and I don't even know what
medical?
to
Is it
say.
adult use retail? Is it, you know, a caregiver? There's, yeah, I mean,
Bay Street, Winslow, they've got one right inside the same building. I mean,
Yep.
it's,
yep. In our area, we actually have very few adult use retail establishments. When you look at the map, most of what you see is actually caregiver operations. So it falls under the medical.
Another place to possibly put some information is town offices. Sometimes people go to the town office to seek general assistance. So I think maybe the first step is figuring out what we want to put on a flyer, poster, trifold, whatever we want, and then find those places that we can share the information.
Don't forget the
Yes.
libraries where people go to get warm.
Yeah, because I don't know that people even realize, like, why would a town office person know where to get treatment for addiction unless we tell them, unless we share that information. The housing piece, I was just told this past week too, that when you're incarcerated, you need to have an address before they'll release you. And this individual had no place to go, so they kept him in jail. They literally kept him incarcerated until he could provide an address.
With that said, that really shows our desperate state of lack of suitable, safe housing for sure. So we've got some great ideas around working as a work group on a flyer for resources, whether that be, you know, substance use resources, or housing resources, which is a little bit more challenging to locate, but some good insight there as well. So give me some ideas and some thoughts, anybody, please, on what our next step is, what you would like to see. Do we want to organize a work group, set that up so that we can start working on that flyer and what information we want to disseminate initially?
Okay, which flyer are we talking about now? Are we specifying information like for the
Linda's brought up
stuff
some
for
excellent
Linda, or
information.
overall?
Overall, really, it would be, I mean, we know that recovery services and needs for substance use recovery is important in Somerset County and in Maine in general, but we've thrown out a lot of great topics and ideas for a flyer. So it would be, you know, do we want to have multiple work groups or one work group working on flyers and having, you know, different topics put out? different information or resources.
I have a question and I'm still working through my first cup of coffee, so my brain's
It's
a
okay.
little more. But is there, I thought I heard through, I don't remember who mentioned it, doesn't matter. Are there monitors downtown, like at the Chamber of Commerce that was scrolling scrolling information on, I thought that I had heard that through somebody, that there was monitors that people could go, and maybe that's, I don't know if anybody else heard that or because I was just thinking if that is the case, we should see about if we had some of these digital posters made up. I have one in a small scale in my cafe right now that I've been trying to scroll partners' information on when I can, and then I'm hoping to get a larger one soon in the fellowship hall, but I don't know.
I know they have the thing in front of the chamber or in front of the town hall that scrolls. Because I remember at the vigil, we were saying, oh, we should have had our information there, that we were going to be there that night. But I don't think we realized that it was even there, which makes me wonder, I don't know if people see it, but I wonder if they do have monitors inside. I've not spent much time in there.
I do remember we did use that at the town office for something community. It wasn't with the church. I think it was, and I don't remember what that was. If it was a community baby shower, maybe the first year we did that. So they're pretty open, I think, to folks using it.
Rob made a good suggestion of using our first in-person group in November for some strategic planning. And that I see a lot of folks shaking their heads. So that, it is a good use of our time for sure in that last hour of our first in-person meeting. And then I just had a thought, even if we look at, if it is a flyer, season-based, we got cold seasons. What are the resources folks need during this time of the year? You know what I mean? And narrow it that way so that it could possibly encompass, a lot and not just specific to one discipline or one resource. But
Lisa, can we have maybe a table and encourage members to bring information with them to put on the table for people to take?
absolutely. That is a good idea. I like that too.
I know historically when we've done some of that strategic planning, because it's such a diversified group, there are so many issues that we could be addressing, but then it becomes overwhelming and we just sit here sort of spinning our heads. So if SCARP picks one or two things that they want to focus on for, say, a year, and then reassess, I think we don't get bogged down as much at that point. Just a thought.
And a good one at that, because you're right. We could all pick something that we're all very passionate about, and that there's a significant need for. But I think if we really look and you can narrow it down, we can address a lot of what we all do within that category in itself. So thank you for that. Any other last minutes before we move into agency updates regarding what we've been talking about in our first in person? Sounds like we've got a good agenda started for November. So I know I'm excited to see everybody.
What are
in
the
person,
hours
so
again?
that was always
Is it-
nice. 9
is it
to
s-
11.
9 to 11. Okay.
Yes. Yep. Just for those in person, we extended it. So. All right, so if if everybody's all set, we'll move forward with our agency updates. And I'm going to go to the right of me and everybody's moved. So Jody, you're it. What's happening in your world of Catholic Charities?
Well, I'm still getting set up here in the Skowhegan office. My biggest struggle right now is finding volunteers. So that's my main focus. There's never an end to clients, but there sure is a struggle finding people to volunteer. We did just get the Good Shepherd grant to work with local food pantries and hopefully be able to develop some partnerships there. So I'm excited to get started with that. And, you know, I'm just trying to, at this point, trying to get out there and get to know everybody. I wanted to say Michelle did a fantastic job at the vigil. I enjoyed that very much, and I learned some things, and, you know, so that was really great.
Thank you. Hi, Dana. What's happening over there at KV Cap?
There. Actually, Tara's usually our information officer for the two of us. She's
Well, then
much- yeah, let her.
Do you want
catch
me to
up
skip
on
you then?
everything. Yeah, I
Okay.
can't think of anything to update other than letting you know that, you know, obviously the rent relief has gone south, but yeah, Tara's really good at, she's my go-to gal.
Heap season is underway, so if you know of anyone that needs, you know, heating assistance, encourage them to apply or make sure they have an appointment. That is easily done through our 859-1500 number. You can call one of the resource navigators and we can help you do that. And I heard, I don't know if it's been officially released, but we heard in a meeting yesterday, workforce practitioners meeting we were at, sorry, there has been an official extra, I believe, $1 billion allocated for HEAP for the whole country. Again, that was from one of Senator King's representatives on the workforce practitioners meeting yesterday. Don't know what the specifics are, but that's amazing. With ERA, you know, rapidly coming to a halt, we're scrambling to offer what we can for people. Other than that, we're you know, we're making adjustments and going along with winter, you know, preparing as everyone else for the upcoming lovely winter season.
Pastor Jen, you have your hand raised.
Well, yes, thank you. So for us, it's really Wednesdays is our big day. We have our free clothing on Wednesdays from 9 to noon, and then again in the evening from 5 to 7. We also have our Cup Cafe, which is open for folks to come in and grab free coffee, snacks. We offer lunches now. We are with some grant money. We're hoping somebody donated a large food warmer. We're hoping we can start serving breakfast sandwiches where people can just come in and take it out of the warmer. Pizza slices, we're hoping to do that. We are going to get some extra storage. We're hoping to be able to hand out free meal kits also. I started serving fresh fruit yesterday and people were just, I mean, I had a lot of little kids there yesterday just eating grapes and having a great time. I mean, so there's a lot of great things going on with that. We also have our personal care pantry and we're in the process of trying to get a display case for that. But if you know people that need shampoo, toothpaste, toothbrushes, that type of thing, send them our way. We also have our Tuesday evening meal, which I put the flyer in the chat. Our next one is this coming Tuesday. It's chop suey, garlic bread and dessert, and they can just call in, no questions asked, order a bunch of meals, and then just come by and pick them up. And let me see, I think that we have also our thrift shop, which is on the church side. That's also open on Wednesdays. So Wednesdays is the day for us right now. And so thank you for that time.
Thank you. Rob, what's going on over at KBH?
So I don't remember if I said it the last time we met. So we were awarded a preventing prescription drug and overdose grant. It's called the PDO grant from the Maine CDC. We are waiting for our contract to be encumbered at this point. But once we do have a signed contract, we will be hiring a 32-hour-a-week harm reduction specialist. It is a position that is very specific to Somerset County. We were one of 5 counties identified in the state needing additional services to try to fill the gaps of our really remote areas. So we're going to be looking at how can we provide services, you know, up in Jackman and other locations. So it's not all Skowhegan or Pittsfield focused. looking at also starting a craft group for adults affected by loved ones' use of substances. The group helps the loved one help motivate their substance using loved one to enter treatment themselves, or if they're already in treatment, how to be more proactive in that positive reinforcement with their loved one that's in recovery to be more successful in their treatment. So got those things going on. Once I get a contract, more to come. So, but we're partnering with Pathways and looking at how to work with one another, not duplicating services, but how to really enhance what's already going on and then transition as their grant ends in the next year. So, yep.
Perfect. Thank you. Hi, Michelle.
Hi, so we have been busy because it's October. Thank you all for your support of our events. The vigil went really well. And we had, a really nice turnout and a really great discussion afterwards at the municipal building. We had the 5K this weekend. That went really great. Just always so great to see so many folks come out to support survivors and to, be together too, because I think that is something that is so special. We do have pizza for a purpose tonight at the Miller's table from 4 to 7. We'd love to see you there as well. It's going to be delicious. We're grateful to them for their support. We do have job openings. Our Somerset shelter is hiring, and our Waterville Outreach Office has an advocate position open. So please check us out there. And I feel like there's always more, but that's what I can think of right now. Just, keeping busy, plugging away. And our community engagement group, I haven't sent out an email because it's been very busy, but we'll meet probably after the DV task force, or, set a meeting date at task force for afterwards. So if people are interested in that, reach out. And if you aren't a part of the Somerset DV task force, you can reach out to Lisa or myself if you want to be a part of that. And I think that is what I have for now. Thank you.
Hey, Sonia.
Hi, so Maine Families, we're always available to do presentations. If you guys need someone to talk about what we're looking for in referrals, what we do. We find a lot of places don't really know what we do, and then moms and dads are confused when we call to see if they want to enroll. But our supervisors are very willing to come and do presentations or Zoom presentations. We did hire for the Skowhegan office. So when he has done his training, we will have another visitor, and it will be our first male visitor. So it's going to be really interesting to be able to have his dynamics there as well. There's still openings, I think, in all 3 locations. So if you know anybody who is looking to do home visiting, we have lots of need in this county and Kennebec for people to help with parenting education. And also, I will say we're not income-based or education-based. Some people turn it down because they think, well, I don't need diapers, or I have a degree. I mean, I've had one of my families had a PhD, but we could still talk about child development and parenting. So it's free, and there's not a requirement for low income.
Thank you. Nicole.
Hi, yeah, so not many updates. Much like Jody, I'm always looking for volunteers across the state, not just Somerset County. They are especially trained advocates like our staff that are assigned to long-term care facilities, and they're able to provide a weekly basis check-in with residents. So versus like myself and our other regional ombudsmen, we have many counties, so we're not able to really go in on a weekly basis and develop those relationships. So the volunteers are really a crucial piece to our team. We also have to be in approximately 355 long-term care facilities across the state on a quarterly basis. So if we didn't have volunteers, we would not be able to be in all those facilities across the state with our very small staff that we have here. But we also, our intake line is open Monday through Friday. 8 a.m. to 4:30. It's a live human being. You don't go through an automated system, which makes it provides less barriers for individuals accessing our services. So if you know of anybody personally, professionally, that is having a hard time accessing long-term care services, as it's really complex, definitely have them start by giving us a call. And if it's not within our role, we do warm handoffs to other agencies that may be able to offer support. We are free and confidential, which I think is pretty important to mention. We don't bill main care. It's literally a free service to the individual. So I just like to put that out there.
Thank you. Deb? Brittany, do you have any updates from?
Sorry,
That's okay.
I'm on a call. I'm sorry. What did you ask me?
I'm sorry, we're doing our updates before we end the meeting. You wanted to know if you had any updates from the Maine Parent Federation to share with us.
Okay, no, I don't really have any updates. I know our trainers are working on a new training on Social Security that's going to be coming out really soon. That's the only new thing that we have going on at the moment, but we do try to keep our website updated with everything. So you take a peek at that and give us a call if you have any questions.
Perfect. Thank you so much.
All right, you're welcome.
Brittany, do you have any updates from Reddington?
I do. Sorry, I just was finishing my sentence for Deb. We are doing our community flu clinics, our annual community flu clinics. First one is today. We're doing it today, Saturday, Monday, and Wednesday. That's free for the community. It's a drive-through, so they just drive up, get their paperwork, get their vaccine, and leave. So we have that going on. In terms of my world, I am doing my first community mental health first aid class. That's primary for the community. We've done a lot of staff ones, and we've done some specific ones for agencies, but this is the first one for the community. It's a 2-night class in November 8th and the 15th. From 3:30 to 8, I think, on both of those days. It's through the Skowhegan Adult Ed Center. So anyone who's interested in signing up has to contact the Adult Ed Center. And then I'm hoping for the spring Adult Ed month, we'll be offering the youth mental health first aid for the community as well. And we always offer both of those programs to local organizations and groups. So if anybody's interested in having a private training with their own organization or group, they can just reach out to me. And that's it.
Perfect. Thank you. So I work for Woodlawn. We're a rehab and nursing facility here in Skowhegan. So we're currently hiring for nursing staff, both nurses and CNAs. We are currently in an outbreak, so we've held off on any of our admissions. So our census is pretty low. We've done very well with keeping our folks as safe as possible and as free from COVID as possible. So, so we're hiring like everybody else is, unfortunately. Good quality staff and long-term care is a tough place to be sometimes. So if you know anybody who is interested, we are a training facility as well. So we do the CNA classes on site for those that are looking to enter into the field as well. So that's all I have. And I really appreciate you all being here, sharing your thoughts. And I am so excited to see you all next month in person if you can make it. So thank you so much, everyone. Enjoy your day. Happy Halloween.